Hi everyone, my name is Dr. Tony Budi. I'm an orthopedic and a spine surgeon at Mount Elizabeth Hospital, Singapore. Today I want to share about cervical spondylotic myelopathy or spinal cord compression in the neck. In the cervical spine, there are two types of nerves. Okay. The middle here or the center, we have a spinal cord, the big nerve. Big nerve is called the spinal cord. It connects directly to the brain. The branches of the spinal cord, these branches of the spinal cord are called nerve roots. The spinal cord gives branches to the nerve roots in every segment of the spine, of the spinal bone, or to be precise, in between the bones. So in between the bones, we have one on the left and one on the right. So every segment in between the bones, we have spinal roots or nerve roots. If we talk about nerve compression in the neck, it can be compression of the spinal cord or compression of the nerve roots or both. What are the difference between spinal cord compression and nerve root compression? Spinal cord compression affects coordination of the hands and legs. The patients complain of unsteady gait. They feel wobbly when they are walking, or they may fall many times. They also complain of difficulty with hand function. Normal tasks like buttoning the shirt or using chopstick or writing becomes difficult. It takes longer and longer time to button the shirt. It can cause tingling throughout the body, but they may not necessarily complain of pain, unlike with nerve root compression. Patients with nerve root compression complain of pain radiating to the arm. Usually it affects only one arm, on the left or on the right, but it can affect both arms. They may complain of tingling and numbness and muscle weakness, but when muscle weakness occurs, it is more serious. It is a sign that the nerve is damaged by the nerve compression. Cervical spondylotic myelopathy refers to chronic spinal cord compression caused by degenerative changes. It does not usually cause sudden paralysis, but it affects the hand and leg function. In contrast to acute spinal cord compression from injury caused by, for example, neck injury or accident, this can cause sudden paralysis. Most patients with cervical spondylotic myelopathy are over 50 years of age, but the age of onset is variable depending on the size of the spinal canal. Some people are born with narrow spinal canal. They are more prone to developing cervical spondylotic myelopathy. So, if elderly people complain of unsteady gait and has frequent falls, it cannot be attributed to old age and left alone. It must be investigated and treated. An experienced doctor will be able to diagnose cervical spondylotic myelopathy in the clinic by taking medical history and doing thorough physical examination. MRI scan and X-rays are required to confirm the diagnosis. Factors that are thought to contribute to the development of cervical spondylotic myelopathy include: number 1, normal age-dependent changes in the cervical disc, most commonly manifested as cervical osteophytes or bone spurs at the margin of the cervical bones. Number 2, arthritis in the neck that lead to facet joint hypertrophy. Facet joint is the joints in the spine. So when the joints enlarge, it causes a narrowing of the spinal canal. Number 3, thickening of the ligaments surrounding the spinal canal. Number 4, translational mechanical instability resulting in subluxation of the vertebral bodies. All these changes can be seen on MRI scan and X-ray. Sometimes CT scan is required to detect calcification of the ligaments. How is cervical spondylotic myelopathy treated? Some people with spinal cord compression have no symptoms at all. The spinal cord is functioning normally. The gait is steady. The hand function are normal, no problem at all. Some surgeons will still operate and some just observe. It is important to discuss with your doctor. If the patients are symptomatic, the gait is unsteady, they have frequent falls, buttoning, using chopstick, writing becomes difficult, then surgery is required to free up the spinal cord. There is no other conservative treatment unlike in nerve root compression. Because the gait is unsteady and the patient have frequent falls, there is an increased risk of acute spinal cord injury which may cause sudden paralysis. Once this happens, paralysis may be permanent even with surgery. What about the risk of paralysis with surgery for cervical spondylotic myelopathy? When we operate around the nerves or the spinal cord, there is always a risk of nerve or spinal cord injury, but the risk is low. Generally, the benefit of surgery outweighs the risk, including paralysis for cervical spondylotic myelopathy. You can discuss with your doctor about surgery to free up the nerves and the risk of surgery itself. The surgery can be done from the front or from the back of the neck or both. It depends on where the spinal cord compression is coming from. It also depends on the alignment of the neck. Generally, if the compression is from the front, surgery is performed from the front. If the compression is from the back, then the surgery is performed from the back unless the neck is hunched forward and cannot be corrected by extending the neck or by looking up. So, in summary, if you have symptomatic cervical spondylotic myelopathy, surgery to free up the spinal cord is the only appropriate treatment. I hope this information is useful to all of you. Please don't forget to subscribe, like, and share this video, and I hope to see you again in my next video. Bye-bye.